Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Good afternoon. Thank you very much for coming this afternoon, Mr. Selbie. I wonder if you could start by just describing to those following this afternoon's session what your role is, and also if you could also set out the name of the document that we're discussing this afternoon.
Yes, so I'm Duncan Selbie. I'm the Chief Executive of Public Health England, and the document that we're discussing this afternoon is our evidence and advice to the government on reducing sugar.
Right, and can you tell me, does this document have a name, just so that we're all referring to the same thing?
Sugar reduction and responding to the challenge.
Responding to the challenge, right. Thank you very much. And we'll start with the document.
Thanks very much. Can I ask Mr. Selbie, at the start, when obviously all the evidence gathering began, were you considering this document that it was gathering the evidence on how to manage child obesity, or was it always marked out as being specifically advice to government?
The origins of this were the Sacking report 2 summers ago, looking at the science behind what was the nutritional contribution of sugar, free sugar in the national diet. You'll know the concern is that all of us are taking in too much sugar, but they've been looking at this evidence actually for some years, and so 2 summers ago that culminated in a science, if you like, a recommendation that the sugar in the diet should be reduced from 10% to 5%. That was then open for further consultation. It was incredibly important that if there was objection to the science, so there was science that we weren't aware of, that was also gathered. So that, if you like, in the summer of 2014 stimulated Public Health England to produce a document at the time called Sugar Reduction Responding to the Challenge, which was, if you like, a research strategy or an evidence gathering strategy about, if the science says that we should be reducing the sugar content in the national diet, how would you go about that? And what might work and what wouldn't work, looking around the world. So over the past 12 months or so, we've been doing this work. We've been looking at the research available around the world, and we've been testing the quality of that research, and that's culminated in an evidence review and advice to government, which we gave to the government on the 9th of this month.
Obviously, it's described there as both an evidence review and advice to government. Could they not simply have been separated? I mean, I understand the principle that advice to government is kept secret, whereas normally an evidence review would be made available.
Well, can I be clear, if I get nothing else across this afternoon, is I don't expect this to be kept secret. I'm fully committed to getting this published, and really important that the committee understands that in the producing of this evidence or review of the evidence, this meta-analysis or systematic review of the evidence and our advice based on that evidence, there's been no fetterment or interference or in any way guidance, if you like, choose your word. It's been free.
Could they not just have been on separate pieces of paper? I mean, we had two panels in front of us last week, which would have been much more productive if we had been able to refer to chapter 2.1.8 showing such and such, and we weren't. So, I mean, the evidence just coming out at the last minute means that people don't have the chance to work with it.
Well, I regret entirely the timing has worked in this way. The advice is based on the evidence. It is theoretically possible to separate the two, but it's one's dependent on the other. Our view was that they were
I totally accept they're dependent on the other, but in other forms of steps in government, the evidence is published and the advice is not. So it's trying to understand why in this case They've been put together, and therefore that has stopped the evidence being published at a time when people could challenge it or come up with a different way of doing it before we actually have a fait accompli on government policy.
So I thought you might ask me why I'm in this position, if you like. So I have three things I wanted to convey. There is no conspiracy. There's no conspiracy of science. I wanted to, if you like, put it in the context of the Sacking report. And Public Health England was the technical advisor to Sacking, and we were also the Secretariat. So it really belongs to us. And we think it's just the most marvellous moment for the government and for all governments, the four home nations, to say, look, we accept this advice. So if you're a public health agency, it doesn't get better than the government saying, we accept your advice. And you know, governments don't change their advice very often about these sorts of matters. So it's been 30 years. It's a fundamentally important moment. Because you might argue that it's marginal at 13 or 14%. But
I'm not, as a doctor for over 30 years, I'm not arguing it's marginal. It's more that there's a lot of interest in this topic, obviously, in the public and in the science field.
So isn't it? I mean, it is a wonderful moment. So we've been working with the government week in, week out. Our ownership is of the evidence, but what we really want is to get the outcome. We want to get a child obesity strategy that's going to work. There's nowhere in the world has such an integrated strategy. It simply doesn't exist. And we are on the cusp of having one. So I've been working with the government. You know there's no silver bullet. There's a range of issues. It's all of government. It's every conceivable part of government. So I reached an agreement with the Secretary of State some time ago, and that agreement's been refreshed, if you like, as the general election, and then the government comes back and says that we're really committed to this, that we would publish at the same time to give the Secretary of State the best chance to negotiate across government a strategy in which we can all have confidence and be proud. Now that if you like, predated these hearings. But I'm not in a position to break that agreement. If you were to say, it's not going to be published, I'd say that's not right. If you were to say that, or if somebody said how I was to write the evidence, then I'd say definitely not right. If I thought that the strategy wasn't going in a positive direction, I'd also be concerned. None of these things apply.
It's just hard, and I wonder maybe you could explain. I can understand that maybe there are different departments involved,
yes.
But when we promote so much both transparency and the tiniest publication of things, how can evidence be bad? How can the knowledge be bad? What the government decide to do with it and how they decide. But I still find it hard to grasp how it can be that knowledge is dangerous, that us simply getting a review of the research evidence across the world is somehow dangerous if it gets into our hands or the public domain.
Well, I don't see it like that. I don't think it's dangerous. I think it's hugely powerful, which is why the timing is so difficult. I want to be helpful. I hope Dr. Wollaston knows that. I mean, we're trying to be. You'll have in front of you tomorrow Dr. Tedston, who is free to speak to the themes in the.
But we won't be able to ask her things because we can't see it and say, Dr. Tedston, what about this?
Well, what I'd like to say to you about, I couldn't dream of being directive, but there are 8 themes to the evidence review. They were set out largely in what we published as our research strategy last summer. It's moved on a little bit. There are 8 themes in which we've given advice to the government. And 4 of them I would commend exploring with Dr. Tedston tomorrow. Reformulation, within that portion control, the advertising, particularly aimed at the children, price promotion, hugely important, and fiscal measures. So if you were to explore with Dr. Tedston tomorrow, what does the evidence have to say, and what's the strength of the evidence against each of those? What would that suggest a strategy might look like? Allows me, if you like, to be as open as can be about, so what have we learned and where's that taken to us, without breaking my commitment to the Secretary of State and the government about the timing of the release. I do want to say I agree with the Secretary of State. I do agree with him that this is so important that we can get potentially have a strategy that is owned by all of government, and that the time that's needed to land that, if you like. But that's what I'm.
And you don't think, just to finish, you don't think that there will be groups who then say, well, we never had a chance to come back and respond to that, and therefore don't engage, or are constantly digging away at it afterwards? Whereas having that final opportunity to say, well, I think you've misinterpreted this, or I don't agree with you, might have given an even stronger chance of consensus.
The Secretary of State has said on the floor of the House, the most accountable part of the whole of government, that he's committed to publishing the report in full. He's also committed to taking this strategy into Parliament so there can be a debate. I am very confident. If I take my glasses off, I can emphasise. I can't see you, but I can emphasise. I am very confident that the quality of our work will define the outcome, the strategy. The strategy will be a first, fully integrated, anywhere in the world strategy to address child obesity.
Can I ask, if he is going to present it on the floor of the House, are you aware of what time prior to that it will be published? Because to publish an 80-page document in the morning and we are debating it on the floor of the House a couple of hours later will not be a fruitful debate.
Secretary of State will need to speak to that. He did say, I believe directly to Dr. Wallison, that he was going to keep the publication date under review. What I want to convey to you is a public health agency like Public Health England has expertise. We don't have the universal answer, but we've got expertise, we can access it. We don't have any money, so all that we can then do is influence. And it's the influence that's so precious, and that's what we're doing to get to a strategy that we can be proud of. I think even you might be surprised at the quality of that strategy. So if I felt that it wasn't going in the right direction, if it wasn't addressing what the evidence has to say, there's no silver bullet. It's not just about fiscal measures. A whole range of issues that are really tough. And yet fiscal measures appears to be ruled out, so we don't get to see the evidence. Well, it's all meant to be hush-hush, but yet what's leaked out is that, well, we won't be doing that. That just seems... Well, what I would say to you, our evidence suggests it could contribute. I mean, last week I was with the Mexicans, but it's not where we would start. Because that's a taster for Dr. Tedston tomorrow. It's not where we would start. Okay, thank you very much.
Thank you, Mr. Selbie. Isn't it going to be extraordinary that we've got Dr. Tedstone in front of us to talk about an evidence base, and we can talk about it freely, but she won't have the document in front of her, and we can't see the evidence upon which it's based? Clearly, part of the problem, surely, is that we need as many eyes on that document as possible to be able to actually decide whether they agree with your evidence review or not. How will people have the opportunity to actually challenge your evidence review in a timely manner if we can't see it?
I hope you know how much I respect the contribution of the Select Committee, you personally, and I'm very sorry to be meeting most of you for the first time and contentiously. I have explained, I hope coherently, even if you don't agree with me, about why I'm doing what I'm doing, which is to say that I've given the evidence and the advice to the Secretary of State. I'm working with him in a very literal way about how that will convert into a strategy. He says to me he needs the time to get to the point where it lands across all of government. I want the outcome. I know that's what you want as well. I want the outcome. But you might want to challenge me in the event that there isn't a strategy, that if there's a disconnect or dissonance between what our evidence has to say and then what does the strategy have to say, then I'd expect to be before you again.
Why shouldn't other people? I mean, we've got the next witness come to see us, has sponsored a petition which more than 147,000 people have signed. There are very many other people across the wider health and public health community that would also like to be able to contribute to this strategy. Why shouldn't they have access to an impartial evidence review?
Well, it is impartial, and they will, just not yet.
But I think what surprises us is that you have a proprietorial sense that there's somehow going to be damage from other people seeing this evidence review. What would be the harm, Mr. Selbie, in other people being able to access that review, that impartial review of the evidence, and to be able to scrutinise it?
The government are asking for sufficient time to have the discussions within and across government to land agreement. I know I'm being repetitive, but if I may, I'm not being proprietary, and I'm certainly not being obstructive. I'm just taking a different view. I mean, evidence or independence in this sense is the judgment I'm making. It's personal, and you're right to. Is that I believe that we'll get to a better outcome by allowing sufficient time. Everybody will get to see everything.
But we're agreed that they're going to publish, and we're agreed that there's been no pressure on you about the content. There's no dispute about that. The dispute here is about the timeliness of it and whether there would be harm in allowing other people to scrutinise your evidence review and other people to be able to use that as the basis of their own representations to government about what should be in the strategy before the ink is dry on the paper.
So it's just the timing of that.
Right, because one thing you have said, although the document was delivered to the Secretary of State fully peer-reviewed on the 9th, you indicated to me that the government had had the evidence package for weeks, so it's not as if they've only just had it on the 9th. They've known, you indicated to me that they've had the evidence package for weeks.
We've been talking about it for months, actually.
Months.
I mean, actually years, because that's why I was to Dr. Whitford putting it in the context of the second report some 2 summers ago, and then, if you like, the fact that it sort of follows a traffic, so there's no surprises.
Right. So no surprises, but what I'm trying to say is that your point was that somehow the Secretary of State needed time, but in fact there have been discussions for a long time about the evidence within it. It's not as if he's just received the evidence on the 9th. He's actually had that evidence for some time.
I can't speak for the Secretary of State.
No, but I'm just asking, is that correct, that he's had the information?
We have been working week in, week out for months in sharing the evidence, as I did with you, if you recall, about the emerging...
You have not shared the evidence with me. I've specifically asked you to share the evidence.
No, we've talked through the emerging evidence. Dr. Tedston and I did talk through what the themes were and, if you like, the balance of the quality of the evidence, because there's a lot of evidence out there.
There is, and that's why we need many eyes on the document.
I understand. It's just a matter of timing. I wish it were different.
I mean, timing is it. You know, we had 2 panels with absolutely conflicting views last week. It is evidence that is in the public domain because it's research. The job that your team have done is they've brought it together in a way none of us would have the time to do. And if we'd been armed with that tool last week, our session would have been infinitely superior than it was, because we'd have been able to challenge or be challenged. And so timing is the point.
I know, and it only makes you more annoyed with me that we have produced an evidence review, a meta-analysis, systematic review that no one else has done in the world, and that we don't have a strategy anywhere in the world to go and draw and learn from. This will be a first. And as a consequence, it's the judgment, or as a consequence, the opportunity we have to actually have a strategy capable of working as a nation. This is tricky. This is not straightforward. It requires a huge amount of negotiation.
And Mr. Selbie, just to clarify, that review, that evidence review, is being paid for by the public. The public and the wider health community would like to see it. As you say, it's not been produced anywhere else in the world. The beauty of it is that it's impartial.
Yes.
And we're formally asking you again, could we see a copy of that evidence review? And if not, what would be the harm in so doing?
And I regret to say again that I've given that evidence package and the advice to the Secretary of State. I've reached agreement with him that we will publish that at the same time. He's committed to publishing it. If you weren't, I would. It will get published, and it will have to, I think, just agree to disagree, if you would, about whether there's any harm. I think the greater harm is that it undermines the possibility of a wider strategy.
Right, so you're saying that you think having evidence, clear, impartial evidence in the public domain, just evidence, would undermine the obesity strategy. Is that what you're saying?
It's a matter of timing. The convention, as you know, is you give advice to. Well, I'm just to say.
I'm not asking for your advice, Mr. Selbie. I'm asking for the impartial review of the evidence.
I'm not giving advice. I'm giving context. The government asked Public Health England, its public health agency, for its best advice. We can only do that by looking at the quality of the evidence.
The advice
it's with the government, and I hope that we'll have a strategy that we can all look at and debate before terribly much longer has passed. I'm not in a position to give that to you today.
But I don't understand why, because they are two different things. They've obviously been stapled together. Could they not just be unstapled? And we get the evidence. We don't need to see the advice. That is confidential. That is traditionally confidential. There's no issue with that. It's actually your meta-analysis that we would like to get our hands on.
Mr. Selbie, one of the things you said earlier on was you said you weren't in a position to break that agreement. Well, I'm afraid you are in a position to break that agreement. And the other part of this session that I just wanted to make clear to you is that there was a great concern, as you'll know, when Public Health England was set up, as to whether or not it would be sufficiently operationally independent from the Secretary of State. And that's why in the framework agreement, there were, in a number of places, it was spelt out very clearly that you have the power, without fear or favour, to publish in the public interest. And I just want to read you one passage in 7.4, and it talks about PHE has operational autonomy. It will operate transparently and proactively and provide government, local government, the NHS, Parliament and MPs, industry, public health professionals and the public with expert, evidence-based information and advice on public health matters. Public Health England shall be free to publish and speak on these issues which relate to the nation's health and well-being in order to set out the professional, scientific and objective judgment of the evidence base. Now, what, may I ask you, is inconsistent about Parliament, with this Health Select Committee, asking you very clearly, we don't want to see the advice, we would like to see an impartial evidence base. That is what we're asking for. Could you please let us have that?
So, I'm very familiar with the framework agreement, and I wrote it. And there's not a public health agency in the world that has greater freedom than Public Health England to speak and to publish to the evidence as we see it. Ultimately, and I know this is not what you want to hear, but ultimately, the ultimate arbiter of that is, if you like, is the right to choose whether I do or I don't. And I'm choosing not to, and I'm explaining why. If I'm proven to be wrong about this, if we don't get a child obesity strategy that reflects the evidence, then I will be accountable to you for that. It's the timing of it that is such a problem.
But do you understand why we feel the timing is a problem? Because there will not be an opportunity for the wider health and community and those who are campaigning on the subject to either examine your evidence review and have many eyes on it in a timely manner, and neither will they have access to that information in order themselves to contribute to the obesity strategy. Isn't that a dangerous precedent to set, and a rather patronising one, if you don't mind me saying so?
I'm sorry you feel that way. That's not what I'm trying to convey. And Dr. Tedston will tomorrow speak freely and openly and share with you, I suggested in those 4 areas, everything that we know and have found out and the strength of that evidence. I'm also hoping that it's not the last time that as a committee we'll be having this conversation.
How can Dr. Tedston possibly be challenged by the wider health community on what she's saying unless they have access to her impartial meta-analysis and evidence review.
Well, she's meeting you tomorrow.
Will she have the document in front of her?
No, she won't.
Why won't she have the document in front of her?
Because I don't wish her compromise. She is absolutely the right witness to have, and I'm sure you'll find her to be a very fine witness.
Do you have anything? Does anyone in the committee wish to add to that? No. Okay. Well, so your position is that the message you're sending is that you think it would be damaging to the obesity strategy to have an impartial evidence review in the public domain. Is that?
You've summarised in that way. Can I summarise that I want to see an outcome for our children, to have a strategy worth the having that requires all of government action. It requires every part of government to commit. Our Secretary of State is leading that negotiation. I want to do nothing to undermine it. In the event, the timing of this is regrettable, and I am very sorry not to give you everything that you are asking for. That is not my wish. If you conflate that with a public health agency unable to tell the truth, I hope to be conveying to you today that is simply not a real or fair observation.
So
you'll be able to judge me, right, I think, in time. Please try and not judge me today.
Well, other people will make their judgments. What I would say is that having written the framework agreement, where you specifically, as you say that you will provide expert evidence-based information and advice to Parliament and MPs, are you going to then remove that from the document?
Not at all. It's a matter of timing.
Well, delayed publication, as you will know, can be as damaging as non-publication if it means people don't have access to that information and advice in a timely manner. That would be my thoughts. But you've set your case out, Mr. Selbie, and thank you for coming today.
Thank you. Thank you very much. Thank you.